would be your first lesson class in your histopathology. We have your fixation. Now, fixation class refers to preserving fresh tissue for examination. So, yan yung way of preserving your tissue in histopathology. Now, fixation is always done class on all samples. Lahat ng samples na ipaprocess nyo for histopathological and cytological analysis, you need to perform fixation. It is the first and the most critical step in histotech. Pag hindi mo siya ginawa, class, hindi magiging successful yung pag-process mo ng tissue sample mo. Now, the primary aim of fixation, class, please take note, is to preserve the morphological and chemical integrity of the cell. So, you want to preserve the original, yung pinaka-original state ng cells and ng tissues of your sample organ. By doing that, class, you would have an accurate, or yung mga pathologists would have an accurate description or an accurate identity on what type of disorder the patient has. Kasi kung hindi mo gagawin yun, let's say hindi ka nag-fix, na bulok yung sample, pag binasa ng pathologist yan, mamaya isipin niya may cancer pala yung patient, pero hindi naman. Ang problema lang, ang nangyari lang, hindi lang na-preserve. So originally, normal talaga yung appearance ng cell, but because you did not do fixation, it caused the cells and the tissues to decompose, and the doctor or the pathologist would have a different diagnosis. Then the secondary goal of fixation, class, is to harden and protect the tissue from the trauma of further handling. So as a medical technologist, class, you will be handling the tissue sample, you will be staining it, you will be exposing it to different chemicals from your decalcification, clearing, and so on. So what is needed is that by fixation, you protect or harden the tissue, allowing it to survive the process. Now, with fixation, class, the shape, structure, intercellular relationship, and chemical constituents of the tissues are preserved. This prevents degeneration, decomposition, putrefaction, and distortion of tissues after its removal from the body. Now, what are the effects of fixation sa tissue, class? It would kill and preserve tissue. Harden soft and friable tissues and makes them handling easier. So hardening is further enhanced by alcohol dehydration. So a necessary step, class, after fixation, if hindi ka magde-decalcify, is that you would proceed to dehydration. Dehydration is done, class, para ma-harden yung tissue. Kasi nga, you have to make the tissue hard so that you could process it easier. Then resistance to hypotonic and hypertonic solution. An example of this is that glacial acetic acid would cause swelling, whereas picric acid, mercury chloride, and potassium dichromate causes shrinkage. So, yung tissue nyo, class, by doing fixation, nape-prevent yung pagka-swell at pagka-shrink. Di ba nga, pag in-expose mo ang cells mo sa isang hypotonic solution, lolobo yan, magsiswell yan. If you expose it to a hypertonic solution, it would shrink. So, by doing fixation, you somehow prevent the swelling and shrinkage of your cell, allowing them to maintain their original size and shape. Then another effect of fixation is that it would cause, or it would produce, a better microscopic picture. The refractive indices of fixative are near to that of clear glass. So mas magiging better yung pagka-view ng tissues and cells mo, class, under the microscope if you fix it. Then take note that the refractive index of clear glass is 1.52. So almost at that refractive index, class, yung magiging ng tissue mo after fixation. And then the last effect of fixation, class, is antimicrobial. Fixation will also serve as an antimicrobial agent, reducing the risk of tissue infection and tissue decomposition. Now, what are the different methods of fixation class, we have number one, chemical. So pag chemicals, you would use different chemical solutions. Then another method of fixation is via heat, specifically via the use of a microwave oven method. Now, when you would use a microwave oven method class, this is a very rapid method because it is a non-chemical method, which means it can preserve neurochemical substances such as your acetylcholine, CHOLINE, then flaming of bacterial smears. Then we have your cold method. In cold method class, there's what we call quenching. Quenching class is rapid freezing. So you would expose the tissue in a very cold temperature, usually for a duration of 30 seconds to 1 minute. Then we have your fresh frozen. Now, fresh frozen freezing is done with the use of refrigerants. Refrigerants could come in liquid carbon dioxide. Yung pinaka-common na ginagamit nating refrigerant class is yung liquid nitrogen. So aside from liquid carbon dioxide, you could also use liquid nitrogen, pentane with nitrogen, and freon gas. Then we also have your freeze drying. Freezing is followed by dehydration of tissues in the vacuum oven, set at a temperature of negative 40 degrees Celsius. Then we have your freeze substitution. The vacuum oven treatment is substituted with the use of acetone. Now, what are the different factors involved in fixation? So these are the things you need to consider, class, whenever you would do fixation. The first one is your hydrogen ion concentration. Pag sinabi mong hydrogen ion concentration, we're talking here about the pH. Now, take note that the satisfactory fixation would occur at a pH of 6 to 8. Dapat ang pH mo is acidic to alkaline at a pH of 6 to 8. Very acidic fixatives, class, could destroy the ultrastructure of the cells and the tissues. Then another thing you need to consider is the temperature. There are different temperatures, class, depending on the type or the purpose of your tissue sample to be used. If you're going to use a routine fixation, yung manual method, class, manual routine method, and for mast cell processing, you need to make sure that the fixative is at a temperature of 20 to 22 degrees centigrade. If you're going to use the sample for electron microscopy and some histochemistry, 0 to 4 degrees centigrade. Pag gagamitin mo naman siya sa automated method, yung autotechnicon, the fixative should be set at a temperature of 40 degrees centigrade. So ulitin ko, kapag manual method ng fixation, 20 to 22. Kapag automated method using an autotechnicon, 40 degrees centigrade. Then if you're going to fix RNA class, RNA samples, 45 degrees. Pag DNA, 55 degrees. Kapag urgent yung biopsy, minamadali ng doktor, minamadali ng patient yung biopsy, you have to use a formalin set at a temperature of 60 degrees centigrade. Then if you're going to fix tissues, lung tissues, class, or any sample that has TB in it, tissues na may TB, you have to set it at 100 degrees centigrade. Kaya nakaset yan ng 100 degrees centigrade para mamatay yung bacilli, yung MTB bacteria. Then you also have to consider the thickness of the section. Gaano ka ba kakapal yung tissue na gagamitin mo, class, or yung section na gagamitin mo. If it's for electron microscopy, the thickness of the section should be 1 to 2 millimeters square. Kapag light microscopy, 2 centimeters square. Pag light microscopy, yung thin, yung manipis, 0.4 centimeter. Then another thing you need to consider is osmolality. A slightly hypertonic solution, usually at a range of 400 to 450 milliosmol, would produce best result. Now, to do this, kung gusto mo ma-achieve yung balance or ideal osmolality, you could add sucrose. Sucrose, class, would help achieve the desired osmolality. Then we have to consider also the duration of fixation. Gaano mo katagal dapat i-fix yung tissue or yung sample. If it's routine fixation class in buffered formalin, you should allow it to be fixed for 2 to 6 hours. Then take note class that formalin penetrates tissue at a rate of 1 millimeter per hour. Then if you're going to use glutaraldehyde in electron microscopy, it has to be fixed for up to 3 hours. Then there are some considerations depende sa tissue, depende sa laki, depending on the size of the tissue. Let's say you encountered a very large sample such as a uterus. Kapag uterus ang sample mo, it should be opened or slightly thinned for the penetration of the fixative solution. So pag very large yung sample katulad ng uterus, kailangan mong i-open yan, kailangan mong i-slice yan before you fix it. Then the brain is usually suspended whole. Yung utak class, buo yan. Buo nyo yang isususpend in 10% buffered formalin for 2 to 3 weeks. Ganun katagal class. Almost 1 month, 2 to 3 weeks to ensure accurate fixation and some hardening prior to sectioning. Then we also have your concentration of fixative. So you need to consider also the concentration. In formalin or formaldehyde, ang ideal concentration class kapag formalin is always 10%. 10% formalin. If it's glutaraldehyde, it should have a concentration of 3%. Then if you're going to use it for immunoelectron microscopy, IEM, the concentration should be set at 0.25% glutaraldehyde. So let me repeat that. Pag immunoelectron microscopy class, gusto mong mag-view ng mga antigens, ng mga antibodies. You want to find the presence of antigens on a tissue sample. You need to use a formalin set at 0.25% glutaraldehyde. Then penetration is also one thing you need to consider. So sabi ko nga kanina, pag formalin, ang penetration niya, yung pagpasok niya sa tissue is set at 1 millimeter per hour. Then volume class, gaano ba kadaming fixative yung kailangan mo? It should be 10 to 25 times the volume of the tissue. So kung ang volume ng tissue mo is set at 5 ml, you need to use at least 50 ml of formalin up to 125 ml so that it would be accurate. So ganun kadami. You multiply it by 10 to 25 times the volume of the tissues to be fixed. Now let's go to the types of fixatives. Now there are two major types of fixatives class. The first one is based on action. Pag sinabi mong based on action, it preserves the anatomy of the section. Anatomy of the section. Now under based on action, we have your microanatomical. Now microanatomical basically covers all fixatives except for a few exceptions. Now, sa microanatomical class, this permits the general microscopic study of tissue structure without altering the structural pattern and normal intercellular relationship of the tissue. So, sa microanatomical class, na maintain niya yung original appearance ng cell, yung original appearance ng tissue without any type of alteration. A very good example of a microanatomical fixative class is your 10% formal saline and your 10% neutral buffered formalin. Now, another type of fixative under based on action is yung cytological. Pag sinabi mong cytological class, pinipreserve niya yung specific part. It only preserves a specific part and a particular microscopic element. Para mas maintindihan nyo kapag microanatomical general, meaning lahat is being preserved. Pero pag si cytological, depende. It depends. There are only specific parts and this is divided into two. Pwede siyang mag-preserve ng nuclear material or nuclear structure or cytoplasmic structures niya. Now, under nuclear structure or nuclear preserved structure, we have the following fixative. Yung osmium tetroxide, also known as Fleming's fluid, ethanol, also known as Carnoy's fluid, Bowen's fluid containing picric acid, newcomer's fluid, and yung Heidenhain's fluid containing mercury chloride. So, itong limang to class, ang pre-preserve niya lang are nuclear structures. Yung mga part ng nucleus ng cell. While the cytoplasmic structures would include the following: osmium tetroxide, Fleming's without HAC, mercuric, seen in Hellis and Senker formol, formalin with post-chromation, chromate, seen in Rigaud's, Muller's, and Ort's fluid. And then the third type of fixative under base on action is histochemical. Preserves the chemical constituents of the cell and the tissues. Now let's tackle them one by one. Let's start with the nuclear fixatives class. Now, nuclear fixatives class would contain glacial acetic acid. Glacial acetic acid class is the primary component. So siya yung major component ng nuclear fixative. The reason is because it has an affinity with nucleic acid and has a pH of 4.6 or less. It would usually contain ethanol. Ethanol gives the most usable DNA fragment. The presence of salts is known to be essential for the maximum precipitation of nucleic acid from alcohol. Then we also have your Carnoy's fluid. This is best for PCR technology. Mercuric chloride or Heidenhain's fluid, set at a temperature of 45 to 55 degrees centigrade. Ang reason kaya siya nakaset kasi it would uncoil. Diba naka-coil ang DNA nyo? By setting it at a temperature of 45 to 55 degrees, mag-uncoil siya, allowing it to react with the fixative. Used for in situ hybridization. And the second one is your cytoplasmic fixative. It must never have glacial acetic acid. Ang reason class, because glacial acetic acid would destroy the mitochondria and Golgi bodies. So, ang glacial acetic acid, pang nuclear fixative lang siya. Hindi siya pwede pang cytoplasmic kasi sinisira niya yung mitochondria and Golgi bodies. Then their pH should be higher than 4.6. Now we're done with the first group. Now let's go to the base on active group. Now based on active group class, we have the first one. We have the aldehyde group. Now aldehyde group class is satisfactory for routine paraffin section, electron microscopy, and for histochemical and enzyme studies. So ito yung mga formaldehyde, aldehyde. So under this group, let's start with the first one, yung formalin solution. Formalin solution could be at a percentage of 37 to 40% formaldehyde or in gas in water. Now, 5 to 10% solution ang ideal formalin nyo. It should always be 5 to 10% formalin solution. It is considered the working solution. It is the most common fixative. Now, 10%, 5 to 10% formalin is known to preserve fat, mucin, glycogen, hemosiderin, and elastic fibers. It can also preserve lipids for metallic impregnation, soft fixative, tolerant fixative. Relatively slow, 24 hours or more are needed for fixation. So mabagal siya class, you need to fix the sample for at least 24 hours or more. Then formalin preparations could include the following. So pag sinabi mong formalin preparation, ito yung mga iba't ibang klase ng formalin class na ginagamit sa histopath. We have your 10% aqueous formalin, 10% formol saline. Now, 10% formol saline class is used in CNS and autopsy sample. So, ginagamit siya for central nervous system sa mga autopsy sample. Then, we have your 10% NBF. NBF stands for neutral buffered formalin, also known as your phosphate buffer formalin. This is the most popular, popularly used, best for hemosiderin demonstration. Then another variation or preparation is your formol corrosive or your formol sublimate. Now itong formol sublimate na to or formol corrosive is used for routine, surgical, postmortem, and research sample. This produces minimum shrinkage or hardening because mercury is a slow fixative, leaving brown pigments. Then we have your alcoholic formalin, also known as Gendry's fluid, used for the preservation of glycogen. Then we have your alcoholic acetic acid, formalin. So those are the different variations or the different preparations related to formalin class. The second one under aldehyde group is your glutaraldehyde. Now, glutaraldehyde could be divided into two concentration. 2.5 glutaraldehyde and 4% glutaraldehyde. Kapag 2.5% glutaraldehyde, this is used for small tissue and needle biopsies. You have to fix it for 2 to 4 hours at room temp. Then if it's larger tissues naman class, you are going to use 4% glutaraldehyde. Larger tissues less than 4 millimeter. Fix in 6 to 8 hours up to 24 hours. Now glutaraldehyde class is a good substitute for initial osmic acid for EM. It gives a tissue consistency and it has a more pleasant smell which is less irritating than formalin. Ang problema lang sa glutaraldehyde class, mas mahal siya, mas mabagal siya mag-penetrate. Can make tissue more brittle, especially in renal biopsy. Then another group is your acrolein and hydroxyadipaldehyde. Si acrolein class at si hydroxyadipaldehyde nyo, they are both used for electron microscopy. They are toxic and they are lacrimatory. Then another active component, based on active component, so tapos na tayo sa aldehyde. The next one would be your mercuric salt. Ang mercuric salt class, they have very rapid action. Slower beyond 3 to 4 millimeter per depth. Di ba nga si formalin, 1 millimeter per hour ang nape-penetrate niya. Si mercuric salt nyo naman, rapid at least 3 to 4 millimeter depth per hour. Now, these are excellent trichrome and brilliant metachromatic staining. So, maganda siya for trichrome staining, metachromatic staining, pag gumamit ka ng mercuric salt na fixative. Best for tissue photography and would always leave a brown precipitate, yung mercuric chloride, in all tissue. Makes tissue unduly hard and brittle and marked shrinkage. Now, under mercuric salts, we have your mercuric chloride. This is the most common metallic fixative. Usually 5 to 7% saturated mercuric chloride. Acidic sublimate, vapor sublimate is used for histochemical studies of panet, pancreatic, and other zymogen granule. This is not good for preservation of enterochromatin cell. Then we have your B5. This is a cytologic fixative for bone marrow. Overfixation of B5 hardens tissue and makes cutting difficult. Saturated alcohol mercuric chloride, Shodin's mercuric chloride alcohol, sublimate alcohol, Huber's Olmacher's fluid and fluid of Carnoy and Lebron, formaldehyde, sublimate. Then we have your Heidenhain-Sousa fixative. This is an excellent cytologic fixative that allows good cutting of large blocks of fibrous connective tissue. It is a rapid fixative that produces minimum shrinkage because of the presence of the acid. Contains acetic mercuric chloride formalin and sublimate preparation. Then we have your Senker's fluid, used for small pieces of liver, spleen, connective tissue fibers, and nuclei. compatible with most stains, gives an excellent trichrome staining, and acts as a mordant. Then we have your Helix fluid, which would also act as a secondary fixative. Now, mercury chloride class is the most common metallic fixative. Then another metallic fixative class is yung chromate nyo. Now, chromate are good cytoplasmic fixative. Leaves a brown precipitate which is removed by acid alcohol. Now, ang variations ng chromate nyo would include 1 to 2% chromic acid. Now, 1 to 2% chromic acid would precipitate all proteins and would preserve only carbohydrates. This is a strong oxidizing fixative, thus requires a strong reducing agent like formaldehyde to counter its effect. Then we have your 3% potassium dichromate, fixes but does not precipitate cytoplasmic structure. It preserves lipids and mitochondria. Then we have your Orts fluid, studies the early degenerative processes and tissue necrosis, and preserves myelin better than buffered formalin. So si Orts fluid yung class, ginagamit yan sa mga tissue samples that came from degenerative disorders and tissue necrosis. Now, the variants of Orts fluid class would include the following, yung regods or yung molars, used for the demonstration of chromatin, mitochondria, mitotic figure, Golgi bodies, RBCs, and colloid-containing tissue. It is a slow fixative and has poor staining capability. Other variants would include Shakau's fluid, Sanfilip's fluid, Colmer's fluid, and Held's fluid. Then another metallic fixative class is yung lead. So you would use 4% aqueous solution of basic lead nitrate. And this is usually used class fixative to for acid mucopolysaccharide and connective tissue mucin. Lily's alcoholic lead nitrate formalin is an example. Then we have your osmium tetroxide class. The osmium tetroxide is best used for electron microscopy. Uses vapors and fumes wherein washing out is avoided. It is a good cytoplasmic fixative, maintains Golgi bodies and mitochondria, but it produces poor nuclear staining. Extensively used for CNS, destroyed by sunlight, kept in brown bottles. So osmium tetroxide class must be prevented to being exposed to sunlight. Then fat would appear as a black mass and tissue would stain well with saffron. Produces brilliant nuclear staining with saffron and inhibits hematoxylin uptake, which makes counterstaining difficult. Expensive class and extremely volatile and is only suitable for small tissues due to poor penetrating capacity. Ang problem sa osmium tetroxide class, pag na-expose ka in a prolonged time, it would cause conjunctivitis or blindness, leading to the formation of black osmic oxide deposit in the cornea. Variation ng osmium tetroxide nyo class would include Fleming's fluid with acetic acid, which is used for nuclear fixation. Fleming's fluid without acetic acid, best for cytoplasmic fixation. Then Setterweiss fluid and Pallades fluid are variations of osmium tetroxide. Then we're done with the mercuric fixative. Let's now go to the metal fixative. Let's now go to the alcohol fixative. Used for small tissue fragments, produces RBC lysis and causes shrinkage on prolonged fixation. Causes denaturation and precipitation of protein by removal of hydrogen bond, leading to dehydration. The concentration class of alcohol fixatives would range from 70 to 100%. Acts as a fixative and a dehydrant. Now, variations or preparations would include 100% methyl alcohol. Methyl alcohol class is always used for blood smear. It dissolves RBCs and bone marrow, considered as a slow fixative and highly toxic. Then we have your 70 to 100% ethanol, preserves but does not fix glycogen, This is a nuclear fixative, fixes tissue for enzyme studies, also causes RBC lysis. Then we have your carnoise fluid. This is the most rapid fixative. Fixes and dehydrates tissues for urgent biopsy and cytoplasmic granule. Causes RBC lysis, produces considerable shrinkage. Then we have your newcomers fluid, which is used for mucopolysaccharide and nucleoproteins. This is better than Carnoy's class for producing Fulgen reaction. Fulgen reaction class reveal niya yung DNA as a component of chromatin and chromosome. Positive would exhibit a magenta color when observed under ordinary light. Then we have your picric acid. Now, picric acid class is compatible with aniline dyes, known to interfere with eosine method and causes RBC lysis. It alters and dissolves lipids. Causes crumbling of frozen section. So, hindi mo siya pwedeng gamitin class for frozen section. Leaves yellow stain to the tissue which is removed by 70% alcohol, followed by sodium thiosulfate and water. Excellent cytoplasmic fixative for demonstration of glycogen. Best for trichrome staining. Highly explosive in its dry form. So kapag ang picric acid class nasa powder form niya or nasa dry form niya, it is highly explosive. Now, the variations of picric acid class would include Bowen's fluid. This is the most popular and would preserve embryos and endometrial purities as well as glycogen. Then we have your Bowen Holland. This is a rapid fixative which causes minimal distortion and does not require washing out since it is water soluble. Demonstrates calcification which produces dark green color on a pale yellow background. Then we have your Brussels alcoholic picroformol. Excellent for glycogen staining. Is less messy than Bowen's. Alcoholic picric acid class na variations niya would include Rossmann's fluid and Gendry's fluid. Then we have your trichloroacetic acid, which would cause poor penetration, can be combined with other fixative, marked swelling of tissue. It is a very poor fixative class, weak decalcifying agent. Then we have your acetone. This is a histochemical fixative, rapid fixation for brain tissue. You have to set it at a temperature of 0 to 5 degrees centigrade. Thus, very ideal siya class for freeze drying and freeze substitution technique. Very poor fixative as well and a weak decalcifying agent. So that's basically class the summary of the entire fixatives class. So I hope you could memorize this. This will definitely come out in your quiz and even in your exam. Now we're done with your fixation, primary fixation. Now there's a process known as secondary fixation. Now the purpose or the reason why we do secondary fixation class is to further improve particular substances. So secondary fixation class is placing an already fixed tissue in a second fixative. So kung binabad mo na siya sa formalin, pwede mo pa siyang ibabad ulit so another type of fixative. That's secondary fixation. Now the purpose of secondary fixation class, please take note, is to facilitate and improve the demonstration of particular substances, make special staining techniques possible, and secondary fixative class would act as a mordant. So ini-enhance niya yung appearance ng cell. Then to ensure further and complete hardening and preservation of tissue. Now, secondary fixation class is usually done before dehydration and on the paraffinized sections before staining, usually with 10% formalin or 10% formol saline as a primary fixative. Then we have your post-chromatization. This is a form of secondary fixation whereby a primarily fixed tissue is placed in aqueous solution of 2.5 to 3% potassium dichromate for 24 hours. So, ang post-traumatization nyo class, similar din siya sa fixation. Pero this time, gagamit ka ng 2.5% to 3% potassium dichromate. Now, the purpose is to act as a mordant for better staining effect, aid in cytological preservation of tissue. Wait lang, okay. Then we have your washing out class. So washing out is the process of removing excess fixative from the tissue after fixation. So you need to wash out class. Kailangan tanggalin yung excess fixative before you would produce with dehydration or decalcification. Now the reason why we do washing out class is to improve staining and remove artifacts from the tissue. Required in prolonged fixation in unbuffered formalin. So if your formalin is not buffered class, you need to do washing out. And if you're going to fix blood containing tissue, such as tissues from the spleen in unbuffered formalin. And then fixation in mercuric chloride fixative. Di ba nga kasi yung mercuric chloride fixative nyo, nagli-leave siya ng mga brown precipitates. So you need to remove those brown precipitates by using washing out. Now, what are the reagents used? Merong tap water. Tap water is used to remove formalin, chromates, and osmic acid. 50 to 70% alcohol to remove picric acid, and alcoholic iodine to remove mercuric fixatives. Now, there's what we call artifact or fixation pigment. Sa lahat ng process class sa laboratory, histopath has the most number of artifacts. So, you need to identify how you would be able to remove these artifacts. Now, artifacts class are defined as any structure that has been produced by the processing of tissue. So, hindi lang siya nag-occur sa fixation. It could happen even in dehydration, decalcification, and other processes in histopath. Now, the structure is not normally present in the living tissue. And these pigments or artifacts are classified as the following: artifact pigments, exogenous pigment, endogenous pigment. Kapag artifact pigments class, this is commonly as a result of fixation. And they normally lie on top. Makikita mo kaagad sila kung view mo yan sa microscope, ito yung mga cell na nasa loob, may makikita ka kaagad na nasa taas na mga artifacts. So you need to identify their appearance. Now, here are some of the artifact pigments. So we have your hematine or formalin pigment. Now, they appear as fine, diffuse, dark brown granules with a yellow to needle-like in cluster. Result of a fixation of tissue in acid formalin. So, napoproduce tong hematine na to, itong hematine pigment na to, if you use the fixative acid formalin. This is also known as acid hematine pigment. Resistant to strong acid, usually associated with blood-containing tissue. Can be removed with alcoholic picric acid. Now, you could use the following washing out agent: 10 volume of hydrogen peroxide, alcoholic picric acid, 0.1% sodium hydroxide or potassium hydroxide in 70% alcohol, and then tap water. Then we have your mercury pigment. They would occur with mercury containing fixatives such as Senkers and Heidenhain Sousa. Can be removed using iodine followed by sodium thiosulfate solution. Then we have your hemosoin, similar to hematine, located in the liver, spleen, and brain of patients with malaria. An iron porphyrin proteinoid complex formed by malarial parasites class from the breakdown of hemoglobin. They do not react with Prussian blue stain. So, hindi sila na-stain ng Prussian blue class. Can be removed from the tissue by saturated alcoholic solution of picric acid. So, to remove hemosoins class, you need to dip the tissue in saturated alcoholic solution of picric acid. This is a birefringent under polarized light in a red-yellow color. The presence of hemosoins can be seen within the parasite and is an important tool for the diagnosis of malaria. Then we have your mercury chloride pigments class. These are irregular brown crystal, extracellular, monorefringent fresh, showing a maltese cross birefringence seen in tissues secondary fix in mercury chloride. Washing out agent class is using iodine and bleach. Then we have your chromic oxide or chromic pigment. They appear as fine yellow-brown precipitate, monorefringent, extracellular, caused by failure to wash specimen in water after chromate or potassium dichromate fixation. Use 1% acid alcohol to remove chromic oxide, usually seen in Senker's fluid or fixative. You have to wash thoroughly the section in water prior to dehydration to prevent formation of chromic oxide. Then the last one, there's the so-called crush artifact, sometimes called the forceps artifact or the squeeze artifact, found in surgical specimens class such as liver biopsy. It shows an intense eosinophilic staining at the center of the tissue. This is due to partial coagulation of partially fixed protein by ethanol or by incomplete wax filtration. So nangyayari itong crush artifact na to class if there is partially fixed protein or incomplete wax infiltration. So hindi na infiltrate ng wax class yung buong tissue. Crush artifacts could be formed. And this would also occur when the teeth of the forceps penetrate the specimen. It results in tears or voids and compression of the surrounding tissue. This can be avoided class by handling the specimen gently, avoid applying unnecessary force, and you must hold the tissue in an area away from the visional tissue, otherwise the tissue will be damaged. So that basically ends your lesson 1 fixation.